GYN Path Review Part 7. Feel free to pause the video to give yourself time to answer the questions. What is the most common schistosomiasis species in vulvar infection? Schistostoma hematobium. Of note, although schistosomiasis of the urinary tract is a known risk factor for squamous cell carcinoma of the bladder, there is not a known correlation in the female genital tract. What is the most common type 2 endometrial carcinoma? Type 2 endometrial carcinoma are not considered to be related to the influence of unopposed estrogen. The most common type 2 endometrial carcinoma is uterine serous carcinoma. What is the molecular profile of uterine serous carcinoma? TP53 mutations are very common in uterine serous carcinoma and immunohistochemistry can be used. There are also high copy number alterations with overexpression of CMYC and HER2. The risk of what infection is increased by the length of time an IUD remains in the uterus. Actinomyces. What is the most common malignancy to arise from a benign cystic teratoma? Squamous cell carcinoma. What percentage of Brenner tumors are malignant? Approximately 1% of Brenner tumors are malignant. Although the majority of them are benign, they must be carefully sampled. What is the name of a specialized teratoma with predominantly thyroid tissue? Stuma ovarii. Papillary thyroid carcinoma can arise from stuma ovarii. What is required in the diagnosis of endometriosis? Endometrial glandular epithelium and endometrial stroma outside the uterus. Blood and hemosiderin macrophages can be suspicious for a diagnosis of endometriosis, but a definitive diagnosis requires endometrial glands and stroma. What stain is useful in identifying endometrial stroma in endometriosis? CD10. What is the staining pattern of reticulin in granulosa cell tumors of the ovary? Staining of a granulosa cell tumor with reticulin will show highlighting of nests or large groups of cells. This is in contrast to the pericellular stain seen in fibromas. What mutation is commonly seen in granulosa cell tumors? FOXL2 mutations. What neoplasms are associated with pseudomyxoma peritonei? Appendiceal mucinous neoplasms are often thought to be the cause of pseudomyxoma peritonei, and when an ovarian neoplasm is seen, it is thought to be secondary. These ovarian neoplasms are thought to result from the incorporation of implanted mucus and neoplastic mucinous cells. I hope you enjoyed this video. To get updates when similar videos become available, please consider liking and subscribing.